Great, lovely. So my name's Jessica. I'm currently a second-year medical student at Mayo Clinic Alix School of Medicine in Phoenix, Arizona. And I am here to talk about ways and strategies to ace the Casper test, as well as general strategies that really helped me in applying to the AMCAS and TMDSAS applications. Here are some important information pre-seminar. So a little bit about myself. I'm originally from Portland, Oregon. I did my undergrad in Texas at Rice University, hence why I have a lot of experience applying to Texas schools. If anyone is interested in that and want to talk more about that, I'd be happy to share more on that because in my humble opinion, I think the Texas schools is kind of like a hidden gem when it comes to medical school applications. You get 13 medical schools in just one application. So it's a lot. If you have any ties to Texas or interest in applying to Texas, I have talked to a lot of my clients about that, and they found that information very helpful. I'm currently a second year at Mayo. I just came back from my first day on clerkships, like first ever clerkship day today. And that was really awesome. I was on neurology service. And my academic interests are predominantly in pathology, specifically in lung pathology, as well as GI and transfusion. But I think I'm leaning towards lung right now. And outside of school, I like to do powerlifting, crocheting, and hiking. So one reason why I'm so motivated to share my experience applying to schools is because I applied to a lot of schools. I applied to 48 MD schools. I did not apply to any DO schools, but I do advise quite a few applicants on DO school applications as well. There's a little bit of similarities there, but there are differences for sure. And these are all the interviews I did during my application process. Including one multiple mini interview at OHSU. And then I also did the Flex Med interview back in my sophomore year. And then on the MCAT, Casper, all of that, I just generally have a big interest in teaching. I think it's really important that we give back to everyone, especially since I utilized a lot of like mentors and I didn't use consulting resources specifically when I applied, but I definitely used a lot of mentors. And so I kind of want to give back to all of that. And at Rice, they have a really, really in-depth peer resource network on advising, specifically in pre-med advising. So that's kind of how I got into all of this stuff that I'm doing right now. For context, about a third of Rice undergrad was pre-med. Now, to the meat of the presentation today, I'm going to talk about the Casper exam. So the Casper test is relatively new in terms of medical school admissions. I believe it was only reinstated or instated a couple years ago to assess people's ability to respond to ethical dilemmas as well as communication skills. So I kind of break down, I'm a stepwise person when it comes to learning. I break down my strategy on acing the test based on like my preparation for the test. So when I started preparing for the Casper, I kind of looked at it as, okay, what the heck is the Casper? That's step one, understanding what the Casper is. So I fully consider the Casper as a combination of many things, but it's mainly a test that's on communication. How well can you listen to and understand information that they're providing you about an ethical dilemma, and then be able to communicate how you would respond. Now, keep in mind, it's like a text-based exam. You're typing up your responses. You're not speaking your responses. So it's less so verbal communication and more so your ability to formulate words. And all of these qualities are important as you progress through medical school, and then also as a healthcare provider when it comes to patients. I will say, having recently taken the step 1 exam, there are a lot of ethical communication problems on the step 1 exam. So that's like one of the board exams that you'll take in medical school. So these skills are transferable, definitely. I think the Casper itself is just kind of a unique exam in which you're doing it in a very time-based manner. So that's why I think it's important to prepare for it. You don't really get any practice in undergrad doing something like this, which is why I recommend all of my clients to spend a couple of days at the very least preparing for the Casper so you can get a high percentile on it. And then for scoring, I didn't include this on the slide, but if everything is the same as when I took it, you get a quartile result. So you'll get like first quartile, second quartile, third quartile, fourth quartile. And you just want to get the highest quartile possible, meaning that you scored in the top 75% of people who took the test. That's kind of what medical schools are looking for. If you don't get top quartile, that's totally okay as well. I think it's more so like a screening thing. If you get like the last quartile, then the admissions committee might question your ability to respond to ethical situations, or your communication skills. It might just be like a red flag on your application, which you want to avoid. Here are some of the example scenarios that I worked through when I was preparing for the Casper test. These are really common. If you search up any consulting service or any Casper preparation article on the internet, you'll find similar ones. They do come up. I think I got the second one on my actual Casper test when I took it. So let's run through some of these example scenarios real quick. So this is just kind of a rundown of what you might see on your exam. You most likely get a video showcasing the scenario, and then you'll get a couple, like 30 seconds or so to kind of gather your thoughts. And then you'll get a couple of text boxes asking you sequential questions that you'll have to answer by typing them out. There's a time limit, I believe it's 5 minutes, and then you submit your response. So the first scenario here is addressing a coworker on their declining performance. This is a really common one where essentially you are put into the role of someone who's working like an office job. So you're not a healthcare worker. A lot of these questions are kind of like imaginary scenarios where you're working a different job. And that's because a lot of these skills are transferable no matter in healthcare or out of healthcare. And then they'll give you like a second part of the question where they'll talk about how might your opinion on this coworker change if you find out that they've actually been going through some personal struggles, like a family member is in the hospital, or they recently are suffering through a divorce or something like that, that is gonna prompt you to be a little more empathic towards their situation. It's kind of a trick. The whole scenario is kind of painted towards you having to respond in a way that's non-judgmental. So you don't want to say that you are going to confront this coworker and yell at them for not being up to your standards. That's kind of the theme through all of this. You want to be non-judgmental. Another common one is the catching a classmate being academically dishonest. What do you do if you encounter something like this in medical school where you are exposed to the knowledge that one of your classmates is like unfairly doing well on their exams because they're cheating? This might differ than what you would actually do in real life, but essentially the essence of your response should be you kind of give them the benefit of the doubt. You don't try to rat them out. You try to understand their situation a little bit more. Definitely encourage them to admit to their faults, because you can't be too on one side. You have to kind of be neutral. So that's kind of how you would answer that one. And then the last one is a healthcare-based scenario where you are a physician and then a patient refuses treatment due to a personal belief. It could be religious, it could be something related to reproductive rights or something like that. And then they're going to ask you how you're going to respond. So again, the general theme here is you want to be non-judgmental and kind of maintain a neutral stance. In healthcare and in medical school, in my curriculum at the very least, this comes up a lot where you'll discuss in some of your social sciences or health equity courses how you would handle situations like this. So I would say this one's definitely applicable and will give you kind of a head start into all of that medical school learning as well. Oh, and I didn't address how you would answer that last one, but essentially the theme is maintain non-judgmental. Ask your patient, like get their perspective on why they're actually refusing treatment, like hear them out, and then try to respond in a way where you recommend the medically correct or medically sound treatment option, but ultimately it's their choice. And obviously there's like nuances in there, like depending on how old your patient is, whether or not they can consent, their mental status, and whether or not they're of sound mind, who their power of attorney is, like all of that. But ignoring all of those like real life scenarios, you just kind of want to maintain a neutral stance. Okay, back to preparing for the Casper. Oh, yes, back to preparing for the Casper. So in my, this is what worked for me. Everyone has a different way of learning and a different way of test taking. But what I did was I memorized an algorithm. I went into the test knowing that there's a time limit and I'm not very good at coming up with things on the fly. So my thought process was if I just have a general framework, I can fit, no matter what the scenario is, I can fit that information into that framework and kind of work from there. And that worked really well for me. I think I had like 5 minutes is not a lot of time to answer all 3 questions on the Casper, but I had like maybe like 30 seconds of leftover time at the end using this framework. So this is my approach. I made this up. Like, I don't know if this approach actually exists anywhere on the internet, but I kind of made it up based on like multiple YouTube videos and articles that I read. But I call it the PPR DJ approach. Essentially, I highlighted the problem first. You kind of want to restate the problem just to show that you were listening to the video. And it's just good in real life too to recap, to give your reader like a summary statement in the beginning. So for a scenario where you're in a team, you're in like a team that's working together, and then people are fighting for some unknown reason, you want to state like our group will not be successful if we fight. So it's literally that simple. You were kind of stating the obvious when it comes to the problem part of this. And then the second strategy I used was perspective. You want to show that you're viewing both sides of the problem. You want to show that you can be kind of like the devil's advocate. So you would say like, I understand why they're fighting, or I understand why their disagreements, why they are disagreeing as they are, but you know, if they continue fighting, that will compromise the result that we all want, something like that. And then you want to highlight your responsibility to do what's right. So in this scenario, maybe you're a coworker and you want to make sure that maintaining harmony on the team is going to help create the product that we all want. And then you also want to make sure that the team dynamic is strong. So you just want to say like, as a blank, I want to do this. And then you want to make a decision. So a mistake that a lot of people make on the Casper is that they end up just saying very vague things and they don't actually make a decision on what you would do in this scenario. It doesn't matter what your decision is really. It matters that you pick a decision and you pick a side to go off of. So in number 2 perspective, if you stated 2 different reasons or 2 different ways you could tackle this problem, you should make a decision on which one you think is more correct and then justify that decision. Like back down, like don't back down, I guess. Like offer support for why you made the decision that you did. And this is just to showcase that you are able to critically think through a troubling ethical scenario and you're actually able to solve something. So this is kind of the mistake a lot of people make. They get too bogged down on like, which one is the right decision? Just make a decision. It doesn't matter. And then justify your decision. Offer some support for that. And then my most important step was practicing scenarios. So there's a lot of free practice Casper questions on the internet. I highlighted a couple here on the slides. But essentially, if you search, there's a lot of consulting websites that have similar like practice Casper questions. I made my own list. Like I just typed up a Google Doc of different scenarios that I found and I practiced answering them by typing them out. And I kind of timed myself too to stimulate a actual Casper exam. But these videos are a great place to start. You might find that when you start, like your thought process is a little messy, or maybe you have a strategy or an algorithm that you really like. Or you want to try out multiple algorithms, that's totally fine. The point is practice makes perfect. And step 4, which is a bonus, improve your typing speed. I personally type at about 90 to 150 words per minute, and this is before like practicing. So that's pretty fast. That made it so that I had about like 30 seconds of leftover time at the end. So you kind of have to be a fast typer if you want to answer all the questions in time. Some people will say that the Casper is kind of like a typing test. I agree. Ironically, like I think I agree. I think it's a limiting factor for sure if you type at less than like 60 words per minute. So just a tip from one student to another, improve your typing speed. And here are some fun little typing games that I use. My favorite is Z-Type. It's like a spaceship battling game. So I highly recommend, and it's all free. But for, go through steps 1 through 3. Step 4 is kind of like a bonus if you have extra time. And then my last recommendations are to sign up for the test early. You need to get your scores in by a specific deadline. It's different for every school, and it's different for depending on when they send you that requirement. But make sure you sign up for the test early on the official Casper website. And then make sure you know which schools you're applying to. I believe there's a cost associated with submitting each school's results. So definitely keep that in mind. And then kind of like jot down some bullet points of what you would say when you watch the video, because the video will not repeat itself. So you watch it once and then you gotta respond. So I would write down on a piece of paper maybe some bullet points of some things that you want to say so that you don't forget. And then work from there. Those bullet points or those first couple of sentences that you type do not have to be perfect. Okay. Finally, I wanted to talk about some application strategies when it comes to applying to medical school. Medical school applications, in my opinion, is a numbers game. Statistically speaking, every medical school only takes about 1 to 2% of students. And so if you really want to maximize your chances of getting in that cycle, I fully believe in applying to as many schools as you genuinely want to go to, but also as many schools as you can in your application timeline so that you can successfully complete all the requirements for them. Now, I totally understand that applying to medical school is very expensive. I was very grateful to have some application fee assistance through the official AMCAS website. So if that is a problem, I highly recommend you applying for that or seeing if you qualify. But I advise all of my clients to very carefully make their school list, because if you just apply to a couple of schools, you may find that the odds are stacked against you. And then my last key point here is to make sure you write your personal statement and activities section, including your top 3 most meaningful activities early. My school made it so that you are actually mandated to complete all of these things by February of your junior year, yes, February, which is really early. But that was so that we had adequate time to review with counselors, to review with our loved ones, peers, all of these things, so that the final thing that you submit when application opens is your final project, your final product. You don't want to just get started on making your application materials when the application opens. And then at the very end here, I'm supposed to talk about my packages, but essentially I do everything. I offer everything. When it comes to my favorites or the things that my clients ask for the most, it's definitely interview preparation, school lists, reviews, pre-med consultations, and secondary application editing. So that's everything when it comes to the application process. I would say that applying to 48 schools was very ambitious for me, but I learned a lot from the process. And so I definitely want to share that with anyone who might find that helpful. And then lastly, I do provide a complimentary summary document after every single session. So you don't have to take notes or anything. You can kind of just show up and learn.